You ready?
Yes.
Yay, Melissa.
Melissa Williams wasn't sure about getting this shot.
Oh, I did it, I know.
She was one of the nurses and doctors hesitant about a new vaccine.
You ready?
I am.
We watched multiple medical workers
Melissa is the reason why I'm doing this.
get their first dose of Moderna's COVID shot.
Oh, we did it, I did it.
Williams told us her hesitancy was based on history. Unethical medical experiments on black Americans date to as recently as the 20th century. It's why some people of color remain skeptical of American medical institutions, even if they work in them. Williams says her own research into how drug maker Moderna tested its vaccine convinced her it was safe.
I like the fact that they actually stopped the trial to get more people of color on this on the trial.
The CDC's Vaccine Evaluation Committee reported in early January that the more healthcare workers learn about how the vaccine was made and how it was tested, the more they trust it. But when we looked into who is actually getting vaccinated across Pennsylvania and right here in Philly, we found a discrepancy in who's getting shots.
Ready?
All frontline medical workers have been eligible for vaccinations since mid-December, but city and state vaccination records show minorities aren't getting a proportionate number of them. The latest Pennsylvania Department of Health report shows 4% of the Commonwealth's doctors and 11% of its nurses are black. State vaccination records show fewer than 1.5% of Pennsylvania's shots have been in black arms. Philadelphia's health department shows 11% of its vaccinations to African Americans.
What you say on a survey you plan to do, is quite different from what you end up doing. Vaccine hesitancy isn't a behavior. Getting vaccinated is a behavior.
Allison Buttenheim studies human behavior and how to prevent infectious disease. Right now, that means figuring out what's stopping some groups from getting inoculated.
When we see those gaps in the numbers, some of that is hesitancy and some of that is logistics and hassle factors and access.
Sometimes, she says, getting vaccinated depends on the health clinic where you work having vaccine in stock. Other times, she told us, the decision comes down to trusting your colleagues.
In this group of, highly trained healthcare workers who are reluctant about this vaccine, again, I think the messenger is maybe even more important than the message.
I got my vaccine today.
Melissa Williams is one of those messengers.
I hope that people of my color see that we are getting it.
Okay.
Yay!
And Melissa Williams and her colleagues will get their second COVID shots before the end of the month. Jim, they told us two things convinced them that the vaccine was safe. First, their individual trust in the scientific data, and then, of course, what their colleagues also said about it.